Hello, my name is Mariana Morfin, and I will be doing my TED Talk on the 3 types of diabetes. There's type 1, type 2, and gestational diabetes. We will first start off by talking about type 1. Type 1 is an autoimmune disease where the pancreas produces very little insulin or no insulin at all. Usually, people from 20 years or younger get this disease. It could be caused by a genetic condition where the pancreas cells attack itself and this just stop functioning and stop producing insulin, which is why type 1 is a lifetime disease, which means that you will need insulin treatment all your life. You can either get this by insulin shots or an insulin pump. I personally do the insulin shots because that's what my doctors recommended. So what I do is, like, when I'm about to eat a meal, which is 3 times a day, right when I'm about to eat, I check my blood sugar, and basically what that measures is like this little meter, and you poke your finger and blood comes out and you put it in a strip, and what that little machine tells you is how much sugar you have in your bloodstream. And depending on what my numbers come out, so it's between 70 and 150, it's normal, so I don't need to put extra insulin. So then we have type 2 diabetes, and normally this type of diabetes is found on people who are overweight, but nowadays you find it like on young adults and children because they don't really stay active, so it causes them to get this type of diabetes. Usually it's 90% of the cases are type 2, and what this type is where the pancreas doesn't produce enough insulin, or the body just doesn't properly use it, like the cells don't want to receive the insulin that the pancreas is giving, so it causes the cells to die. This type of diabetes is people who are overweight, African American, Hispanics, Asian, Pacific Islanders, and Native Americans. Usually people who have history of diabetes in their family will get this type of diabetes. And women who have a baby and it's like 9 pounds or more will end up getting type 2 diabetes later in the future. And the last type of diabetes I will be talking about is gestational diabetes, and this diabetes is basically a woman has this diabetes during her second trimester of her pregnancy, and this only occurs in 4% of women that are pregnant. And this type of diabetes disappears once the baby is born, but most likely if you get pregnant again later in the future, you will have this gestational diabetes. And the older you are when you're pregnant, that's the higher chance you will of getting gestational diabetes while you're pregnant. And usually women who have this diabetes during their pregnancy end up having diabetes type 2 later on in the future. Some myths about diabetes is some people say, oh, if you eat too much sugar, this causes diabetes. Personally, my mom used to think that way. She used to be like, oh yeah, it's because you ate so much sugar, so that's why you have diabetes. And she tries to scare my siblings, my brother and my sister, not to eat that much sugar because they're going to get it, but it's not true. That's not why you get it. You get it either because it's genetic or something in the environment. But my doctor doesn't even know why I got it because it's not. None of my family has it, so it's just me. Insulin will harm you. My mom personally thinks that insulin harmed me, so she wanted my doctor to take me off insulin, but she was like, oh no, insulin actually helps your daughter. It's not like it's harming you, because some people think that, oh yeah, once my grandma started taking insulin, she like died, but it's not true. It's like it helps you. It's what you need to survive if you have diabetes. Some symptoms of diabetes, like if you're not sure if you have it or not, it's extreme tiredness, increased thirst, weight loss, and you go to the restroom a lot, and cuts or sores that don't heal well. I personally had extreme tiredness. I would always be sleeping. I was always drinking water. I lost a lot of weight. Looked like bones.